Hey, this is Dr. Bob with Carolina Value Pet Care. Thanks for joining us today. One question that comes up occasionally is if their dog has actually had a vaccine reaction. Now, fortunately, we use what we feel are the highest standard of vaccines in the industry, the highest quality vaccines in the industry. So for the number of vaccines that we give, we seldom see any vaccine reactions. But the reality is they do occur, just as vaccine reactions can occur in people. And generally speaking, there's three different forms of what we call a reaction or side effects. Now, the most common reaction or side effect that we see is going to be post-injection discomfort. Same with people. Think about how many times people go to get a vaccine. They go to their local pharmacy, they get a vaccine, or go to their physician, they get a vaccine for flu in particular, and they've got a sore arm for a couple of 3 days. Well, that's going to be the case with many of these dogs, or I should say not many of the dogs, thank goodness, but it is the most common sort of side effect or reaction that we do see is just post-injection discomfort. Simply, we use some children's aspirin. It's a great way to help your dog get through any discomfort, sort of sluggishness. If they're lethargic, if they just not feeling well, you can give them some children's aspirin. And we give the children's aspirin, and that's an 81 milligram aspirin. And you give one children's aspirin for every 15 pounds of body weight. So let that be a reference if you ever feel the need to give it, or if your dog seems to be in any mild discomfort, whether from vaccines or from other sorts of sources of pain, you can use aspirin. Don't use Tylenol. That's probably the most important takeaway here. Do not use Tylenol in dogs, but you can use aspirin, okay? Second most common problem that we might see is going to be from intestinal upset. Now, to be honest with you, I think a lot of these dogs that might exhibit vomiting or diarrhea or just seem to have kind of a queasy stomach, I think a lot of cases that's going to be from anxiety. It could be from the car ride. It could be from the anxiety of being in a strange place. It could be the anxiety of other dogs, but just anxiety in general and just the discomfort of being out of their comfort zone might lead to some intestinal distress or intestinal upset. What to reach for? Good old Pepto-Bismol. And you can give 1 teaspoon for every 10 to 20 pounds of body weight. Use the liquid Pepto because dogs have a tendency not to chew the tablets very well. Now, unfortunately, the Pepto liquid doesn't taste that great to dogs, but it does work quite well to help settle a dog with an upset stomach. And of course, if they've been spitting up after the vaccine, then you don't want to feed them for several hours after you get them back home. Now, probably the most dramatic form of a reaction that we see in dogs is facial swelling, swelling of the ears, swelling around the eyes, and what we call hives. Now, hives shows up as multiple bumps all over the torso, all over the body, and they just look like little bumps popping up on the skin of these dogs. That's the least common reaction we see, and that is a true vaccine reaction. And when we see that, those dogs do need attention. Now, in most cases, most pet parents are able to manage those at home with the use of Benadryl. Now, with Benadryl, we use a dosage of 1 capsule, which is the adult strength. Benadryl is a 25 milligram. We use a 25 milligram capsule for a 25 pound dog. There is a children's Benadryl, which you can also use as well. There's a chewable children's Benadryl, and it's a 12.5 milligram. So for a smaller dog, use the 12.5 milligram. Use the children's Benadryl. You can do it about every 6 to 8 hours. It will likely make them quite sleepy, and it does take hours for the swelling to go down, but give it time and it will eventually go down. If for any reason your dog exhibits any difficulty trying to breathe, then by all means you would need to see a full service veterinarian or to get to an emergency clinic where it will be taken care of more aggressively. When we see a dog come back to us that actually does have the swelling, and again, it seldom occurs. We might see 3 or 4 cases a year, just to tell you how uncommon it is. But we also give those dogs an injection of a type of a cortisone or steroid in order to help alleviate the signs and symptoms. So here the dogs are uncomfortable, but seldom do we see these dogs show any grave distress by any stretch of the imagination. We don't expect to see these life-threatening reactions like what might occur with a person when they get a bee sting. So those are, generally speaking, the three forms of the reactions or side effects we see with vaccines. Very uncommon, but they do occur, and hopefully this will give you a little bit better guidance of how to manage it should it occur to one of your pets. So hope that helps. Thanks for visiting us today, and hope to see you soon. Thanks, and make it a great day.